En LPZ biedt ons...
LPZ enables us to consistently measure the pressure ulcers in our locations within Vivre, which in turn allows us to compare our figures with those of similar institutions to determine how well we are doing.
I think
the advantage is that we can now put targeted measures in place to improve the level of healthcare.
Grundsätzlich verursachen Stürze.
The fact is that falls, pressure ulcers and malnutrition are associated with high costs. Moreover, they lead to an impairment of the patient's quality of life.
Verbunden mit einer Einschränkung der Lebensqualität für den Menschen.
And as a health manager, I need to address this challenge by working in an evidence-based manner, including benchmarking.
Beweise anzutreten und sich auch Benchmarking zu betreiben, auch schauen, wie schaut's in anderen.
We look at the situation in other countries, like Germany and the Netherlands, from which we will greatly benefit here in Graz, southern Austria.
Gemiddeld met het land.
Comparing our performance with national averages and trends will tell us what works well and what needs improvement. We'll also look at our various locations to see how they are performing. If a particular location scores poorly, to use a term of phrase, it doesn't necessarily mean their performance falls short. If we get these figures in and find a score that deviates strongly, we first need to identify the reason.
Hoe komt dat nou?
Heuer haben wir das Thema Sturz.
Our current theme is falling. We're running a pilot in neurology, traumatology and ophthalmology, which will be used as a practical case study.
Und es wird aufgrund der Situation.
Based on the LPZ findings for this year, a rollout in the other clinics will follow.
Rollout in den einzelnen Kliniken, in den restlichen Kliniken.
Together with the university, we're developing a program to reduce restraint measures. LPZ provides me with a measuring tool that enables me to quantify its level of success.
Maastricht University developed an annual independent prevalence measurement system for healthcare issues within the Dutch healthcare system. Participating in LPZ gives insight into the prevalence, prevention and treatment of specific healthcare problems. LPZ also offers suggestions for improvement. LPZ is used in both intramural and extramural healthcare institutions. I'm all right. I'll do some tests on your husband. I've come to do the measurements we discussed yesterday. Measuring is done with standard materials based on a fixed protocol. Looks fine. I'll enter this into the system. As an alternative to a paper version, data can also be entered straight into the software using a laptop or iPad at the bedside. LPZ is a reliable and validated method. All data are processed anonymously.
Ik denk dat we er bewuster mee bezig zijn nu.
I believe we are more aware today of the need to prevent pressure ulcers and intertrigo. We're more alert to them than we used to be. For the client, it means we'll look at it on a daily basis in order to provide them with the best possible care.
Elke dag.
Would you bend your leg for me, please? Right.
We now have a 0% score on intertrigo. We find that the measures we've taken worked out really well. I think we should go on like this. As for the malnutrition, in fact, after struggling with this for the last year, we finally see some improvement. LPZ helps me to focus on quality improvement within this department. It actually provides me with a practical tool to help do things even better compared to others. We need to pay even closer attention to our clients.
Jan, wat bij jouw afdeling opvalt
Jan, compared to last year, I notice an improvement in your department. Only the intertrigo is worse compared to last year.
In addition to their own measuring results, national data, as well as results from recent years, are presented.
We've acted on this, managing to bring it down to 0. My priority is not to have better rates than my colleagues, but to deliver the best possible healthcare level, and LPZ really contributes to that.
LPZ is an effective tool to identify and reduce healthcare problems. It reduces costs and it leaves more time to provide more effective care, which makes healthcare work even more fun. Each year we'll choose a different healthcare problem as our theme. Last year it was incontinence. We're aware that it's a taboo issue, and we made sure our healthcare workers received proper training in helping patients suffering from incontinence. Incontinence material has also been improved. It turned out to be quite successful.
Wij managers zijn er nogal goed in.
Us managers are quite keen on having our people measure all kinds of things, whether it be costs, bed occupancy or protocols, etc. They hate that, and I understand, which is exactly why they don't mind to fill out the LPZ questionnaire. Because LPZ is precisely what their job is about.
Meting raakt de kern van hun beroep. Verzorgenden.
Healthcare workers and caregivers are actually quite proud to see pressure ulcers percentages go down. It means they are doing a good job.